use to help her in labor.
Leah Hedinga and her husband Drew are getting ready for baby Jack, working with their doulas for a natural birth, with their delivery at Ascension Providence Southfield's alternative birth center, with the hospital's skilled midwives guiding them through.
We wanted to be able to have that experience of the midwives there to support my husband, to support me, and to have them with us the whole time, because I've spent this entire time getting to know each of the midwives.
The midwives there have been incredible. They put our mind at ease a lot. Every visit that we've had has been, they're professionals. They're really good at what they do.
But at the beginning of February, the hospital's 6 midwives, who have close to 200 expectant moms, were let go. They are out of a job at the end of the month.
I was crying and I said, I don't know what I'm going to do, because we're only a couple weeks out, and is anybody going to take us? Is anybody going to take our insurance? How can we transfer with just 4 weeks left in my pregnancy? So that was really scary.
The loss of these 6 women in a great setting, it was just alarming.
Marissa Geiske is due in April. She had her first baby naturally at the alternative birth center and was excited to deliver there once again with the midwives.
I knew that once I got there, everything was going to happen as it should. And it did. You know, I had the birth that I was looking for.
Now these mothers are scrambling to find an alternative. These midwives are out of a job, and critics say this hospital is no longer providing important care for mothers and babies.
So in all my years as a doula, I've never been an activist. But for 25 years, I've worked to improve birth in my community. And to see a hospital taking a giant step backwards in time, I couldn't stay silent.
Doula Celeste Kraft says the midwifery model is proven to provide better outcomes for moms and babies, something desperately needed. The U.S. has the highest maternal mortality rate among high-income countries, and the infant mortality rate is much higher as well.
The midwifery model saves lives. It improves outcomes. It lowers the cesarean rate. It lowers the preterm birth rate.
Ascension released a statement saying families can still utilize private practice midwives with the necessary hospital privileges. But Kraft says this is really all about money, and now neglecting an entire segment of low-income mothers and many women of color on Medicaid.
To be able to access this quality of care, regardless of your income, is huge. And to take that away, honestly, it's unconscionable.
We're hoping that this could still be a possibility, and that the decision will be reversed, because this is essential for healthcare for women and for babies.
A rally is planned for Sunday from 2 to 4 outside of Ascension Providence Hospital on 9 Mile Road in Southfield. All are welcome. In Southfield, Amy Lang, Fox 2 News.